We use a program called LeanPath that helps us monitor our food waste and analyze the data. So not only can we reduce food waste, but we can divert it from the landfill, which means that we're either composting or we're donating it to a local community organization. LeanPath is a data system, and it has a scale and a camera and a touch screen, and it's very easy to put the food in any container that would normally be thrown away. It takes about 30 seconds to enter some data about what it is, what's the weight of the container. Those are already built into the system. And then that allows us to see what is the food that we're wasting, what sort of food are we wasting the most, where is it coming from, why might we be wasting it. We are working on making our operation more efficient overall. So that allows us to move forward, evolve. It allows us to use our resources. Our goal overall is to reduce waste and become more efficient in our kitchen production. That will allow us to focus on more innovation and more quality. Also divert food that's going to the landfill and make sure that it goes out to the community. And eventually we're going to be working on composting food scraps. So that will be a net benefit overall instead of going to the landfill. Reducing food waste not only helps us in our kitchen overall be more efficient, but it also helps us connect to the community through food donations, and it also helps us meet sustainability initiatives such as composting, reducing waste overall. It allows the staff to feel like they're participating in something valuable because no one likes to see food get thrown away. And then the more efficient we can become in the kitchen, the more resources we have to use to do other things, to do new things, to focus on quality and patient safety, of course. There are organizations that are out there to help you. So I'd recommend reaching out, seeing there's grants that are available, seeing what organizations are involved in food waste reduction, reaching out to other food service directors, reaching out to other healthcare institutions. Even some restaurants and casinos are using food waste reduction program. So I just recommend reaching out and finding the resources that are out there for you.
Well, we wanted to keep up with the times and what other hospitals were doing county-wide. First thing we did was put a lot more grilled vegetables, a lot more different kind of variety on our salad bar. Then we started incorporating that into our patient care meals and our retail meals. It's been a big hit. It's been challenging and fun, but there's a lot of things you can do with vegetables. Tofu is a good item to use. It's very versatile. Obviously, beans, legumes, all that stuff goes great in casseroles and things like that. We started doing stuff on the salad bar, more grilled vegetables, more lean meats, and it's just, the reception's been incredible. We're keeping it up, we're gonna keep moving forward with what we're doing and hopefully make it a more healthy environment to eat. Living in Southern California with the abundance of lots of fresh fruits and vegetables available, local farms, things like that, it can be very versatile and very flexible. Some examples of some of the cooking techniques that we do is, instead of frying, we'll bake a lot of our items. And that keeps a lot of fat out of what the patient will be getting. We'll do mac and cheese, but we'll come up with a lighter cheese sauce using a low-fat cheese as opposed to a full-fat cheese. And gradually working more fruits and vegetables into our menus, we started to do meatless Mondays. And that's one day a week that people can look at and say, hey, maybe I don't want to eat meat today. We'll do eggplant Parmesan instead of chicken Parmesan or something like that. That way, it's kind of sort of what they want, but it's vegetarian. One thing we did for Fries Fridays was we don't have the fries available. We don't have them in sight so people can see them. Normally we'd have them on the line and you can grab them and go. If they ask for fries, we'll give them to them, but if they don't, we just keep it out of their sight and maybe they won't eat it that day. The advice I would give to incorporate new items into your menus is to start slowly and just gradually work stuff in. Switch out regular fries for carrot fries, things like that. If you do it gradually and slowly, people start getting used to it pretty quickly. If you present the food attractively, I think that's a big part of it. People will look at it and say, this baked tofu looks a lot better than this fried tofu. And if you incorporate different sauces and different cooking techniques into what you're doing, it gets people interested, and I think that generally made a big change.
At UCSD Health, the reason we wanted to start serving antibiotic-free proteins was to help with decreasing the incidence of antibiotic-resistant cases in the hospital. One of the things we found out is that about 70 to 80% of the antibiotics that we receive is from the foods that we're eating, and so we thought this was a great effort to start the process. The first decision we had to come up with was what was going to be the biggest impact. So we kind of thought to ourselves, what are the foods that we use the most that there are antibiotic-free options. And the two that we came up with was ground beef and then also chicken breasts. So we just then decided we were going to find what sources we could get those items from. And our chef went out and did some investigations, some research. We reached out to vendors and he brought in different products, and we did just test trials. And we picked the product that we thought was the best and that had the best nutritionals for us so that it could spread across the diets as much as possible. And then we just started purchasing from those vendors. The challenge with sourcing of any of these of the antibiotic-free proteins is purely price, and then how do you get it? You can get the proteins from a lot of different sources. It's getting the price to a point where it's something that our budget can handle. So we've had to be very creative in how we find ways to either decrease serving sizes or increase the pricing when possible, but the increase in the pricing only works in the retail side. And the majority of the meals that we're serving in the hospital are for patients, which there is no price increase in that. So you have to find a way to incorporate that increased price without exceeding your budgetary limitations. Any advice that I'd give for any hospital who's trying to start using or increasing their sourcing of the antibiotic proteins is find a way to bring in smaller items and bring them in one at a time, test them, make sure that they're the right item for you in the first place, taste, flavor, quality. Then, once you know what your price point is, find a way to work it into your budget. You may have to give up on some other things, maybe make a 4-ounce serving instead of a 5-ounce serving, or maybe even go down to a 3-ounce serving to find a way to get the availability for those proteins to be in there, and then shop around. The big thing is you have to shop with your purveyors and see who's going to provide you the better price. Sometimes you're better off going directly to the vendor. Other times you're better off using your GPO to get those prices. The benefits that you get from using the antibiotic-free proteins is that you have a decreased consumption by the patients and also the staff and the customers who come and visit us at both of our medical centers. The other thing that you have is you get some recognition that there's a problem with the way that we are preparing and producing our animal proteins with there being so much antibiotic use that's not necessary. So that's been one of the big things. And then we use it as a marketing tool to be able to say that we're doing things above and beyond what people are aware of in the cafeterias, to show them that we care about their overall well-being and not just, we're just here to provide food for them.
Scripps embarked on a new program this past year with emphasizing sustainable and healthy eating in all of our cafes in the hospitals and also in our corporate cafes. We use our automated food production system to take our nutritional analysis and display it on our digital menu board. This allows all of our visitors, employees, physicians, and any patients that come in the cafes to see what our sustainable food offerings are, along with what is vegan, vegetarian. We also show gluten-free, and then we also have Eat Well meal deals. It's a brown box which comes with a half a sandwich, carrots, hummus, a bottled water, and it's for $5. Our branding incorporates all parts of our food and nutrition department. So our cafes are called Colors Cafe. Our catering program is called Colors Catering, and our patient meal service is called In-Room Cafe. We branded ourselves after colors because we felt it was important to eat a colorful plate of food to get the most nutrients every day in your diet. Scripps felt it was very important to standardize our food service departments for our system. This helped us get better quality food for better prices. Since we have standardized our menu, it allows us to afford buying from our local vendors, which helps our local economy. Our Scripps cafes have done a great job over the last couple of years with standardizing our logo and our menus. The way it's helped our organization is it has reduced our food costs substantially while we have increased the quality with sustainable food products. We're able to buy from local vendors, we are able to buy hormone-free products, we're able to buy organic fruit and vegetables. This way, our customers know whatever Scripps Cafe that you go to, you're getting the same quality of food. My advice as far as promoting sustainable food is you have to do a little bit at a time. and still offer a variety of foods to everyone. For us, what really helped is letting our population know that we do have sustainable food, we do have a lot of offerings, but it's all about moderation in your daily diet.
Myself and our executive chef, Alicia Bell, we are part of the Nutrition and Healthcare Leadership Team. So that allows us to work with other hospital chefs and food service directors to share best practices, collaborate, come up with ideas, and share together. I started out just going to meetings, and then I was nominated and accepted as co-chair with the director for UCSD. I did that for a couple years. And now our executive chef is the new co-chair. So looking at all that, we'll have been involved, Palomar in the coming years will have been involved with nutrition and healthcare leadership for about 4 years. It's a very interesting and dynamic group of leaders in healthcare who have a passion for nutrition. It allows us to partner with a community health organization so we can move forward health and sustainability initiatives throughout institutions in San Diego County. It's been a great collaboration for any healthcare institution that participates. We are able to share best practices, ask questions. We get a lot of administrative and planning and outreach support from the Community Health Improvement Partners who runs the group. And meeting with other directors and leaders in healthcare and focusing on nutrition allows us to, as I said, to collaborate and to share and to grow together. Well, hospitals have an important role in the community for being what could be considered anchor institutions that model and provide healthcare services. If you're in San Diego County, it's very easy to get involved. You can contact any of us or Nutrition and Healthcare Leadership. If you're outside San Diego County, or maybe even if you're outside of the state of California, it's just important to start reaching out to people and see what sort of groups you can organize, see what resources are out there for you, what sort of support you can get.
Advice that I give to everybody for who's trying to start a new program or anything is start small, get a lot of little small wins. Realize that moving forward one step is a great accomplishment. Don't try to go from 0% to 25% in a year. Start out, get the small steps, get the wins so that you feel confident about what you're doing, and then you have to market all the efforts that you're doing. If you're doing something great in sustainability, you need to find a way to get that message out to the people you serve and the people you report to understand why it's so important to do it. And it also gets you a lot more support in return is because they know that you're trying to do something for the right reasons.